Dr. Rodman, question of the day. Will buccal fat removal cause the face to appear more hollow and aged over time?
So that is a very common question that I get. And the short answer is no. That is not what causes the face to look aged. Removing buccal fat is not going to make your face look older. However, it's a good question because I think the thinking is right in that loss of facial fat is what causes us to look older. But the buccal fat is not facial fat that makes you look younger or older. So I want to show you this example. This is one of the Galderma books, which shows how when we're young, these are the superficial fat pads of the face. So this is what's giving fullness, high eyebrows. As we get older, these fat pads shrink. And as you can see over time, these literally deflate like a balloon. The fat pads become smaller. And without this superficial fat pad, you start to look hollow under the eyes, the cheeks start to look sunken, jowls start to form, this crease, nasolabial fold starts to happen. It's the reduction of the superficial fat pads that make the face start to look more hollow. And so the buccal fat is actually deep to all of that. And so removal of that creates a different look. It doesn't necessarily create a more aged look. It slims the cheeks, which can look more defined. And some people like that aesthetic. Other people prefer a more round aesthetic, which would mean keeping your buccal fat. But age and buccal fat are not necessarily related in the same way some of the superficial fat pads of our cheeks up here are related to aging. And to give you an example of what I mean by the fat pad is deeper, there's superficial fat pads. These are deeper fat pads. The buccal fat is even below all of those. And that's why I take the buccal fat from inside the mouth. It's deep to all these more superficial fat pads.